Hi, welcome to the expert series on meningitis awareness. My name is Rekha Lakshmanan with the Immunization Partnership, and today we're going to discuss the importance of vaccine confidence for U.S. public and economic health. The Immunization Partnership is a more than 15-year-old nonprofit education and advocacy organization based in Texas. We educate the community about the importance of immunizing, and we identify and advocate for policies to ensure access to vaccination to support high immunization rates. The Immunization Partnership worked with Jamie and Patsy Shambaum and later Greg Williams to pass the first college meningitis vaccine requirement in the country, which we are very proud of. In today's session, we're going to review the burden of vaccine preventable diseases, specifically invasive meningococcal disease, or IMD, understand the health and economic benefits of meningitis vaccinations, and discuss ways to improve vaccination rates. Oftentimes, we forget the consequences associated with infectious diseases. Diseases like chickenpox can cause pneumonia, a measles infection can lead to blindness or death, or human papillomavirus, or HPV, may become cancer. It's important to remember the burden of vaccine-preventable diseases are not inconsequential. When we look at meningitis specifically, the consequences of invasive meningococcal disease are extremely serious and potentially life-threatening. Prior to the availability of quadrivalent meningitis vaccines in 2005, the incidence of IMD was estimated to be 0.61 cases per 100,000 people. In a study by Restrepo et al., researchers examined the health and economic burden of IMD in individuals. In the 618 patients studied, there was a wide range of short and long-term health complications observed, including brain disorders, heart problems, limb loss, and kidney conditions. It's important to note that IMD outbreaks are often unpredictable, and when they occur, they have a mortality rate of 10 to 15% within the first 24 hours of disease onset. The long-term impact of invasive meningococcal disease can range from reduced life expectancy and complications to economic hardships such as decreased productivity. Not only does meningococcal disease carry a physical burden, there are also economic implications as well. For example, in a study published this year, the authors Shaw et al. Found that the direct work-related costs associated with meningococcal disease was about $62 million. Breaking down those costs by case, the overall productivity loss, direct and indirect, associated with IMD showed $722,458 per case. So not preventing meningitis can be costly and deadly. We touched upon the burden of meningococcal disease. Now let's talk about how we can prevent it. In the 18th century, Edward Jenner discovered the smallpox vaccine. 2 centuries later, the Centers for Disease Control and Prevention declared immunizations as one of the 10 greatest public health achievements in the 20th century. The health and economic benefits of vaccination are tremendous. In less than 20 years, immunizations have prevented 500 million illnesses, 1 million deaths, and saved over $500 billion in direct and indirect healthcare costs. Simply put, for every $1 spent on childhood immunizations, our country saves $11, and more importantly, lives are saved and deaths prevented. We are fortunate in the U.S. to have a meningitis prevention program. Vaccination against 4 strains of meningitis, ACWY, was approved in 2005. With the approval of these vaccines, the cases of meningococcal disease for those 4 strains decreased 2 to 3 times in the vaccinated adolescent groups compared to the unvaccinated groups. 10 years later, in 2015, meningitis B vaccine was introduced and approved in the U.S. It is estimated that there are between 100 and 200 cases of Men-B across all ages each year. Based on the burden of disease, the Advisory Committee on Immunization Practices recommends the first dose of meningococcal ACWY vaccine at 11 to 12 years of age and a booster dose at 16 years of age. Meningitis B vaccination is recommended between 16 and 18 years of age based on shared clinical decision-making. Despite the availability of meningitis vaccines, we still have a lot of improvement to make in immunization coverage rates. In 2024, more than 1/3 of U.S. adolescents were not fully protected against meningococcal ACWY. Meningitis B was even worse, with more than 80% of eligible teens not fully protected against Men-B. The 2020 pandemic led to a decrease in teens coming in for well visits, which has contributed to lower vaccination rates. On top of that, we have started to see an increase in new cases over the past few years. In 2024, 500 new cases were observed, which is the largest report of cases since 2013, with most of those cases being traced back to serogroup Y. Although there was a slight increase in meningitis immunization rates between 2023 and 2024, the overall rate for both doses of meningococcal ACWY vaccine and Men-B vaccine are still low. Let's take a minute to talk about the current vaccine environment and what steps we can do to improve vaccine confidence and immunization rates. Vaccine hesitancy is not new, and hesitancy really is on a spectrum. While there are those who don't support vaccination, the majority of people do support vaccination. Oftentimes, those parents are in the middle. They simply have questions about vaccines and need their questions answered. However, we are seeing more hesitancy after the 2020 pandemic. For example, 71% of Americans support MMR vaccination for school entry. However, this is down 11% from 2019. This year, more than 1,300 cases of measles have been confirmed, and 3 people, 2 of which were children, died. And why is this? Well, some people think it's unnecessary. Misinformation and deceptive information is creating confusion and fear, and therefore influencing parents' decisions to not vaccinate. Social and digital media accelerates this misinformation. And among some people, skepticism with government authorities turns them away from vaccinating. The good news, though, is parents still see their children's doctors as a trusted resource. There are a few ways to foster a positive experience for parents. 1, create access points to make it easy for parents to bring their kids in. Whether it's Saturday clinics or extended clinic hours, parents may need more timing options. Their hesitancy isn't because they don't support vaccination. They simply have an access issue. Use techniques such as motivational interviewing to create an open dialogue with parents or families. Listen with compassion and patience. Use reminder recall systems to ensure patients come back on time. And lastly, social media is highly accessible and used as a source of information by the general public. Parents may turn to online sources and communities, so be available to counter online exposure to misinformation. In conclusion, our values are about protecting one another from harm. Supporting public health measures like vaccination heralds that. Vaccination prevents or mitigates disease, saves money, and keeps our communities safe. No one should suffer from diseases we can prevent. And as a final reminder, you and your peers continue to be a trusted resource. Your recommendation, counseling, and advice builds confidence in families to protect their children against disease and devastating health outcomes. Thank you for your time and all you do. We would love to get your feedback on this video or other topics you're interested in. Scan the QR code on your screen to give your feedback. And to learn more about meningitis, visit meningitisawareness.org.